Hello, everyone. For my presentation, I will be talking about Creutzfeld Jacob disease. So for this presentation, I will be discussing the background, how the disease is transmitted, what signs or symptoms are shown, how the disease is diagnosed, who are the high risk groups, and the prevention strategies that are currently in place. And lastly, I will talk about case management. According to the National Institute of Neurological Disorders and Stroke, Creutzfeld Jacob disease is a degenerative fatal brain disorder. It is a very rare condition that affects approximately 1 person in 1 million per year globally. The US is afflicted with 300 of these cases per year. And there are 3 categories that the disease is split into. The first one is sporadic, hereditary, and acquired. And for this, the disease forms even though the person doesn't have any risk factors, and this is also the most common type of Creutzfeld Jacob disease. The second type is hereditary, in which the patient has a family history of the disease, or if there are any mutations present in the family. And lastly, the third type is the acquired category, and this is transmitted via exposure to brain or tissue. And it's most likely when the patient is exposed to infected material during a surgery or procedure, and this is the least common of the 3. CJD causes holes to form in the patient's brain, giving it the name spongiform encephalopathy. In animals, this is known as bovine spongiform encephalopathy, or more colloquially as mad cow disease or scrapie. It is caused by a prion protein that cannot be killed or destroyed. The protein takes on an extremely stable conformation that is interestingly more stable than the normal conformation found in healthy animals and humans. Now on to transmission. CJD is not contagious and cannot be transmitted through touch or airborne particles. However, exposure to nervous system tissue and fluids or brain tissue from an infected person can lead to its transmission. There have been cases during procedures where parts of infected brain tissue was grafted into another individual who then consequently got CJD, and this includes corneal transplants as well. Additionally, CJD can spread if electrodes are not cleaned sufficiently or sterilized when implanted into the brain. Unfortunately, there have also been cases where patients were injected with human growth hormone originating from infected cadavers. Like we spoke about in food safety, there was an outbreak in Great Britain and France due to contaminated beef. This led many people to believe that perhaps the bovine spongiform encephalopathy could be transmitted to humans. However, tests showed that we cannot prove whether this transmission route is in fact valid. And the last point are blood transfusions and plasma transfusions. However, these have not been shown to cause CJD. However, the abnormal prions could accumulate in larger concentrations in an infected patient's lymph nodes, and this could potentially spread the disease. So there is a policy in place stating that you cannot donate blood if you have lived or visited an area where bovine spongiform encephalopathy is common. So signs and symptoms. The patient can present with rapid onset of dementia, muscular coordination problems, impaired memory and judgment. The patient can also have personality changes, visual changes that can lead to blindness, depression or insomnia, myoclonus, which is muscular contractions and jerks. And in the very last stages of CJD, the patient cannot move or speak, and they eventually enter into a coma. And it's respiratory infections that are the most common cause of death. To diagnose, since CJD has similar symptoms as meningitis or inflammation of the brain, these first have to be excluded. And doctors need to perform a neurological exam along with a spinal tap and EEG. MRI is also taken to see if the problem arises from a stroke or tumor rather than from Creutzfeld Jacob disease. And they can help confirm CJD based on characteristic plaques and degeneration in the brain. Currently, the only way to diagnose a patient with CJD is with a biopsy of brain tissue or an autopsy. One of the setbacks of taking a biopsy is that it puts the patient at risk, and also the biopsy taken may not be from an infected area in the brain. Even autopsy procedures prove to be risky as the examiner may unintentionally infect themselves from the brain tissue. However, there have been developing tests that take a patient's cerebrospinal fluid and can recognize proteins that are indicative of neuron degeneration. Since CJD can be inherited from a mutation in the prion gene, patients can possibly get genetically tested. And the mutations in this gene are autosomal dominant. And the doctor should also take comprehensive family history to hone in to the CJD diagnosis if there's a familial cause. High-risk groups, as stated prior, you cannot get CJD from contact with another infected individual. Those with family members suffering from the sporadic classification of CJD do not have a higher risk of developing the disease. High-risk individuals, however, are those who may have received human pituitary growth hormone or NS tissue transplants. As well, individuals who have lived in England during the bovine and spongiform encephalopathy outbreak from 1985 to 1993, and those who are related to CJD patients have a higher risk of developing the disease. According to the Mayo Clinic, it is currently unknown how one can prevent the sporadic form of CJD. Hospitals and clinics have various prevention strategies in place to prevent this disease. Human growth hormone is now synthetically made rather than extracted from pituitary glands of cadavers. If a patient or individual is known or suspected of having CJD, the instruments used on their procedures are thrown out and destroyed. This follows suit for instruments used for lumbar punctures. And also any instrument that has had contact with an infected patient is discarded. People who are considered high risk are not allowed to donate blood, and high risk meaning those who have a relative with CJD, have had neural tissue grafts or growth hormone injections, went to Europe during the bovine spongiform encephalopathy outbreak. To prevent animal-infected tissues from contaminating food sources, there have been restrictions on beef exportation from where bovine spongiform encephalopathy is problematic. For the production of vaccines, cow parts are used. The FDA states that the cow components should be from low-risk countries. As well, disposable surgery instruments are highly recommended because the abnormal prion proteins are extremely hard to disinfect and to destroy. Healthcare workers should be well-versed in CJD precautions when treating or working with an infected patient, such as frequently washing hands and exposed skin, covering up wounds and cuts, wearing gloves when handling the patient's tissues or fluids, and using face protection if there is a risk of getting splashed with blood or with cerebrospinal fluid. As discussed earlier, if a patient presents with symptoms of rapid progression of dementia, impaired memory, visual changes, or myoclonus, we first have to rule out if this patient has had these symptoms due to other conditions such as meningitis or encephalitis. There must be certain examinations done to confirm or deny the diagnosis of Creutzfeld Jacob disease, such as a full neurological exam, including testing on the cranial nerves and reflexes as necessary. A lumbar puncture and EEG should be done as well. There are certain proteins that enter the CSF that are indicative of degenerating brain cells, and this may be found as a result of the lumbar puncture. An MRI would let the physician know if there is a vascular occlusion or a stroke that may have caused the presenting symptoms as opposed to Creutzfeld Jacob disease. And although brain biopsies are not the #1 choice to confirm the diagnosis of CJD, they are done with risk to the examiner. Thank you so much for listening to my presentation. I hope you all have a good day. Thank you.